Gosh, that was a time on that slide where we could all be together, wasn't it?
Yeah, very different times.
That's better, I can see now.
Yeah, I'm just calling in people on the list just in case if they're struggling to get in. I know we've got a few minutes before we make a start.
Hello, Hannah. Did I see Hannah?
Hiya, yeah, sorry,
Yeah.
I just switched my page as you said hi. Hiya.
Hi, Anna.
And Rhiannon? Yes, yes, we've got Rhiannon here as well. That's lovely.
Mm.
What's going on here?
Okay.
It's frozen.
Yep.
Like waiting for a train, isn't it?
Okay, so I think most people are in now. Okay, let's have a check. Okay, there's a few people not.
I think people perhaps might join as we go on.
Did you want to make a start?
Yeah, should we? Are you ready, Lynn, to make a start?
Great, thank you.
Okay, Rhiannon, that's great. Thank you very much.
That's lovely, thank you. Can you stop sharing the slideshow now? Oh, that's down, lovely, thank you. So, Prynawn da, everybody. It's an absolute pleasure to open this session and welcome the Deputy Minister, Lynn Nigel, to an Iron Bevan University Health Board, albeit virtually, for a discussion ahead of the event that follows to promote the Dementia Hospital Charter, which is planned for launch in the spring next year. We are honestly delighted as a health board to have been chosen for the pre-promotion event, and I'd like to also welcome colleagues from Improvement Cymru, Alzheimer's, and of course our very own stakeholders from the Iron Bevan footprint. My name is Rhiannon Jones. I hold the post of Executive Director of Nursing for the Health Board, and I'm the Executive Lead for Dementia, which is an absolute privilege. We have an active regional dementia board, which is multi-agency, vibrant, and importantly person-centred. Our aim is simple, and that is to improve the lived experience of people with dementia and their families. And whilst that is a simple statement, it is without doubt an undeniably complex agenda. The Hospital Charter for Wales is a much welcome development, which will ensure a consistent and dementia-friendly approach across Welsh hospitals, and we honestly can't wait for the launch next year. We wanted to use this special opportunity to very briefly share a number of our local developments as part of our dementia plan and to profile some of the great work happening across our footprint with partners. With the time allocated, it's obviously not possible for us to cover everything, but some examples include meaningful activities, our dementia companions, dementia champions, the RITA units, and the introduction of coloured walking frames, just to name a few. If okay, I would just like to use a little bit of our time for some of the members of our dementia board to share their work. Firstly, I'm going to invite Amanda and Sian to provide a very brief overview of the proof of concept project that is currently happening at Ysbyty and Iron Bevan in Ebbw Vale, followed by Rebecca, who can provide an overview of her role as a dementia champion, and then finally over to Tanya, who would like to just briefly share some of our dementia companion work streams. So a very big welcome, Lynn. Thank you for giving an Iron Bevan this opportunity. And I'd like to go over to Amanda and Sian now to provide an overview. Diolch yn fawr.
Lovely. Thank you, and it's a pleasure to be here.
Thank you. So I'm just going to give you a very brief, as Rhiannon has said, an overview of the proof of concept that we introduced in one of our community hospitals, which is the Ysbyty yn Iron Bevan. And what we did there was we took the whole holistic view of the environment, the staff needs, patient needs, visitors and carers, as well as our volunteers. And what we aim to do was develop a programme of improvement, which included introducing dementia companions onto our wards so that they could side by side people with dementia. Mainly at the moment, people with enhanced levels of care who are displaying some levels of distress whilst being in hospital. So we knew that simply introducing the volunteers wouldn't be enough to create the cultural changes that we would be looking at. So we did a suite of reviews, audits, measures and action plans to be able to enable us to be able to facilitate some of those changes. So we're very pleased to say that's going really well, and the evaluation will take place now at the end of November, where we're very happy to share our findings around that. But a big part of that programme of care was around educating, awareness, so using our good work framework to be able to promote that within our staff, our volunteers and our carers groups. So if I can hand over to Sian will tell you a little bit more about what that programme looks like.
Thank you. Well, it's an absolutely exciting programme to be part of, and it has brought so much laughter and joy, especially with the patients and the dementia companions. So it's such a privilege to be working on this. My name's Sian Hanniford and I'm the project manager for the person-centred care team, and I've been delivering the workshops in dementia awareness and meaningful activities with Amanda, and I can see Helen Jones as well here, who've been supporting us. And I must say, we've had a fantastic response from the wards and the ward staff and the ward sisters to enable them to release the nurses to attend the training. We've, as I said, developed the training. We also include how to manage patients with challenging behaviour, how to engage in meaningful activities, how to make their well-being and their life and their experience in hospital a lot better. And Helen's also brought along the GERT suit, which you can try on and experience what it feels like to feel older, and how it feels to get up off a chair and to turn around and to eat your food or to chat to somebody. As I said, we're going to do, as Amanda said, we're going to do an evaluation at the end of the month, and it's been fantastic. The only thing I would like to say is the dementia companions have had so much fun. They're using the Rita, and we've got patients at YAB, one in particular who likes horse racing. So they use the Rita to stimulate a horse racing event, and they watch that together and they absolutely love it. So that's just one example. Thank you.
Thank you, Amanda and Sian. Say it's a very brief overview just to give a flavour of some of the work that's going on. Thank you both. Can I bring in Rebecca now?
Hello.
Hello.
Hello, I'm Becky Snellgrove, and I'm one of the dementia champions onto the ward on B4 in the Grange. So my role is really just cascading all the information we can give to other champions on the ward and what we can help with staff when having patients with dementia. So currently on our ward, we provide visiting with purpose. Obviously with COVID being the way it is, we've got to be a bit more things, but it helps for the family member who is in hospital to have that person to help them and guide us as well. We have This Is Me books, which is provided by the family. So it gives us a bit more understanding what food they like and they enjoy, what activities they enjoy, what things we can help to make them feel more comfortable in this very strange environment. Also on the ward, we've got our activity box, which has got crosswords in there, puzzles, colouring in, things that will just keep them entertained, because obviously it's not a very nice place to be, is it, in hospital for anyone. And we also use the Ritas, the twiddle muffins and the pop buttons to keep their fingers entertained and keep them going. What else have we got? I can't think what we've got now. So sorry, I made a list and I'm just trying to think of all the things. So we've got the blue plates and cups on the ward, so identify where the meals and drinks are. We encourage staff to reminiscent, so obviously talk about past things, talk about their lives, and it makes them feel a bit more comfortable with us. We encourage family to bring pictures, teddies, to bring their own clothing in, so then they feel like, you know, hospital gowns ain't the nicest material. They updating relatives daily on how they're progressing and how they're feeling, emotions. We do that with virtual visits as well, with obviously our iPads, which is run by some of our other members of staff with the iPads, and accessing patients with enhanced care needs. So this is obviously with patients with our one-to-one enhanced levels. So then they've got a person then that can encourage them more with activities on a one-to-one basis. We also involve older adults like us, oh my god, my teeth ain't in, for advice and assessment, ongoing support. As part of the stroke service, we offer assessments as well, so wellbeing assessments, to help with the following stages from that. And we also have got staff training booked between the 8th of November and the 1st of December for every member of staff on the ward to attend. And we've got Saging Time as well. And we work with other champions on the ward to cascade information and any new ideas. So obviously we've all got some ideas to bring on, and we all listen and get them all together in a big bubble.
That's lovely. Thanks, Becky. And I think that Becky is clearly very passionate about this agenda, and I think the importance of having champions across, and not just our wards, but out in the community as well, people with passion that really ensure that this is a high priority within the care environment. And Becky's just listed a range of activities there, which just demonstrates a person-centred approach and our absolute commitment to ensuring improved lived experience, as we identified at the beginning. Thank you, Becky. Can I bring Tanya in now, just to give an overview of the, we've heard about the companion role. Sian and Amanda just touched on that, but I just wonder if Tanya would like to give a bit more information.
Yeah, hello, Lynn. Yeah, I know Sian and Amanda have already mentioned it. I suppose it's important to say that the development of the role of dementia companion has been born very much from people's feedback. So it's whether that's the patient on the ward, whether it's the staff or relatives who obviously can't visit now. And we've worked very closely with the Community Health Council, who've done an independent observation, if you like, of interaction with patients on the ward, and we've done our own internal patient experience surveys. And what we have found is meaningful activity is so important. We've got a long way to go, we know that, but the work that we're doing collectively, you know, as a health board and as partners, is to bring in dementia companions that can support people who are, you know, when they can't have visitors, but also who have behaviours that challenge as a distraction more than anything. What we're really excited about is the work we're doing with colleague Gwent, and their health and social care students aren't able to have placements as we know it, but we've worked very closely with them. We have 56 students due to join us in January, and these students will support the meaningful activity agenda. So they have a programme of learning themselves. They learn about dementia. Matt Lloyd, who was on the call, is helping us to get the students trained up to be digital champions as well, so that we close the loop. We close the loop really, and I suppose just to finish this, we're learning every day. So every day something else comes up, and we think, Okay, a dementia companion could do that, or our staff could do that. And we're just so excited. And the hospital charter, which is integral to our inpatient action plan, embeds all of this person-centred care. So we're really, really excited. Thank you.
Brilliant.
Thank you, Tanya. And I think Tanya touched on something really important there as well, and that's the challenge of visiting restrictions. It's been so difficult for the patients, but obviously the families as well. So the companions are a vital component to the support for individuals with dementia in hospital settings. And that challenge continues, particularly as COVID continues to be rife in our communities and there continue to be visiting restrictions. We've obviously got visiting with a purpose, so some individuals can have visitors, but again, we cannot overestimate the importance of the volunteers. Absolutely critical with this agenda, and we're very grateful. No, Tanya just mentioned there the work of the Community Health Council, and Wendy Thomas is on the call as well. They have undertaken a review of our work, the proof of concept in Ysbyty and Iron Bevan. So would it be okay if we asked Wendy to just provide some feedback of that, because that's really important, because it is independent as well, and we welcome and value that support. Is that okay, Wendy?
Yeah, that's fine. That's fine. Hi everybody. Just like the people that have said before, the Community Health Council have been absolutely thrilled to be involved with this project, and we did undertake an independent review up at YAB. A colleague of a new member and myself went up to looked at the 3 wards, but concentrated particularly on Sahawi ward. First things that struck us was the commitment of the staff and their excitement in bringing on the role of dementia companions. So many brilliant ideas in evidence on the ward, as Amanda has touched on, the training that is taking place, and the willingness of the staff to be involved. So many ideas, you know, we from the information that was provided to us, just absolutely brilliant. And I mean, the ward on the day was extremely busy, but that enthusiasm, you know, the staff, you know, stopped to chat to us, and it was absolutely brilliant. And this is so crucial to help dementia patients. I mean, obviously we visited a dementia ward, but hopefully with this initiative going forward, it's hoped that dementia patients in the general ward setting on medical wards that are in our acute hospitals, is so important that things like this can come in and you know, really help a person that's got dementia. I was full of praise for the visit that we did and our findings. A credit to the staff, and I know our official report that came to the health board really did reflect that. So it's just great to be part of this, and as everyone has said, it's just so exciting, and I'm sure that it's going to go from strength to strength.
Brilliant.
Thank you very much, Wendy. I mean, we've got many people on the call, Lynn, to include our older adult mental health colleagues who support psychiatric liaison, nutritionists and dietitians. Again, you know, so important. Becky mentioned there the use of crockery, but you know, that's one element to the whole nutritional agenda. We could go on, but I think that was just a helpful flavour of just some of the stuff that's going on. And we'll probably just open it up to yourselves if there's any questions or any areas that you'd like to probe further. Thanks, Lynn.
Oh, lovely, and thank you so much everyone for having me, and also for sort of giving me that snapshot really of what you're doing. And it sounds like you're doing some really excellent work, and I know that unfortunately you're doing it in incredibly challenging circumstances because of the pandemic. I know from my own personal experience, just how important that care in hospital is for people living with dementia, and how hard it can be to get that right. So I really do appreciate all that you're doing, and the work of the champions sounds brilliant, and it's great to get that sort of independent feedback from the CHC as well. So thank you for all that you're doing in really, really difficult times. It really is appreciated. I suppose from me, it would just be handy to get a sense of if there are any particular challenges that you think are proving. I mean, I'm sure there are countless challenges, but if there is anything that you're finding, particularly intractable, or that you can see coming down the track towards you in the months ahead, really.
I'm sure there are quite a few people that will want to come in. I know from my perspective, and it's probably just been triggered from the proof of concept in Ysbyty and Iron Bevan, and that's releasing staff for training and awareness raising. I think because of the challenges we've got with staffing deficits, whilst there's a huge appetite for wanting to take this agenda forward and recognising the importance of it, we've just not been able to go at the pace we would have wanted in YAB because of the ability to release staff. However, never foiled, the team have come up with alternative approaches, which is about training alongside individuals as opposed to taking them out of the environment. But that is a definite challenge. And I think just the scale of what we need to do, recognising, I think Patrick's on the call as well, I know, but I think the diagnosis of dementia and still getting through that, the approach of people being scared, they often recognising they may have some cognitive impairment themselves, but don't want to come forward and have assessments. They don't want a diagnosis. So that's limited then in terms of the amount of support we can put in. I think they're just two of the things. There'll be hundreds of things I'm sure colleagues will come forward with as well. But I think from a charter perspective, I'm honestly delighted. As Tanya said, it's a key part of the inpatient work stream. John's campaign has been so important in terms of really, but even embedding that has been quite challenging, despite it being relatively straightforward, or what you think would be straightforward. There's still challenges. So I think whilst we've, I consider we've got a great and innovative team, and we've done lots, we can just guarantee that through the complaints that we receive and some of the serious incidents that happen, we've still got an incredible amount of work to do in this area, and I wouldn't underestimate that in any way. But I'll open it up to others. So it's not the Rhiannon show, I know, but I'll open it up. Thank you.
Thanks.
Katie.
Afternoon, everyone. My name is Katie Whitehouse. I'm a dietitian working in an Iron Bevan, and I am the nutrition and hydration lead, so I link between dietetics and catering services. And I'm relatively new to post, but my previous experience was in acute dietetic work, so I'm familiar with the ward setting and kind of observing dementia and an eating experience. And what I picked up from the charter really clearly was the increased risk of delirium within this patient group when they come into hospital, and the recommendation for diet and fluid to be monitored quite closely with assistance where needed, and social interaction, which could really help with their intake. Now, the charter only strengthens the kind of standards that we have, that we try to adhere to at the moment, which is the All Wales Catering Standards and the Health and Care Standards, because that is touched upon in these as well. So I'm really excited for this to add strength to the standards that we already aim to achieve in the hospital setting. And I think that we are taking proactive steps within this area to audit what our current practice is. For example, red tray systems. Becky mentioned about the blue cutlery. And we're doing lots of screening to see what our kind of compliance is with even identifying patients that might be at risk, and that, you know, we know massively includes the dementia cohort. But as Rhiannon said, I think staffing is where we really struggle, because we often recognise the challenges, but it's very difficult to implement change because that means lots more people doing more jobs than we're already asking them to do. So it's not the willingness, it's often the staffing pressures. that we've recently done a pilot project in the Royal Gwent Hospital, and this was on a hip fracture ward, but with a kind of frail cohort, a lot of elderly care patients, where dementia was quite prevalent, where we had a ward-based nutrition support worker. So this role was a ring-fenced role. It didn't kind of come under nursing. It was housed by dietetics, but the member of staff was ward-based. And there was the responsibility to do the screening of the patients, to weigh the patients, to implement ward level care plans, to provide assistance and mealtime coordination. And as a result of this role, we recognised improvements in all aspects of care, including kind of fundamentals around the eating experience. And clinically, a reduction in delirium from 20% to 4%, reduction in IV fluids, reduction in antibiotics associated with UTIs, AKIs, that kind of thing, and even length of stay. So whilst there's huge staffing problems within nursing, I'm not sure there are within the kind of nutrition world, and actually this would be a really exciting way to move forward, is by having a ring fence role for nutrition to try and improve the outcome for these patients. So I know that's on the agenda for kind of nursing within an Iron Bevan at the moment, but I'd be really keen as part of the charter to look into kind of ring fence and a bit more nutrition support on the wards so that we can improve nutrition and hydration outcomes for these patients and hopefully get them out of hospital quicker. Thank you.
Yeah, and a really good way of maximising what can be done with people when, you know, when everybody's so stretched, isn't it?
I mean, it's an excellent piece of work with demonstrable outcomes, and just for Katie, Peter Carr, who's the Director of Therapies, and I are having very active conversations about the importance of the role, and my absolute point that we should look at nutritional support assistance, but not from nursing, because it's a depleted workforce anyway, and yet that's an exciting role for other bodies. So we are actively pursuing that agenda. I think what Katie's described there is that sort of research and innovation approach, which is excellent. We've been doing a really important piece of work with Katie Featherstone as well around a research project. This is not published yet. I think Katie might be on the call, but so fundamental in terms of the way that we treat people with dementia, particularly around catheter care, bowel and bladder care, and overuse and overprescribing of pads and incontinence products. So much work to do, and we're actively working with Katie Featherstone and are quite excited about what we'll be able to achieve through that work, even though we're very disappointed with the research results. We were an active participant site, the first site in Wales to join that national piece of work. But again, just demonstrating that we're constantly looking at new and innovative ways to drive this agenda forward. Thank you.
That's brilliant. And I'm Katie Featherstone's work from my previous role when I was a backbench MS chairing the cross-party group on dementia, and it's great that an Iron Bevan have work really. And I know sometimes it's difficult, isn't it, when you get that feedback then, which is challenging, but I also think it's really important, isn't it, to have that honest feedback and you know, clearly you're really willing to take that on, and I think that's incredibly important as well.
Yeah, absolutely. So it is about that research to drive improvement, and that independent review of our position, because sometimes you're blind to it yourself. Sometimes that independent research-based approach is really critical. So yeah, absolutely, we're really pleased to be part of that, and we'll continue to work with Katie in terms of the improvement work, which is great.
Yeah, thank you, Rhiannon. And I'm just going to jump in because I'm conscious we've got the other link. So I wondered if there were anything, Lynn, you wanted to ask about anything before we go on the next call. I'm sorry to interrupt.
Okay.
No. You know, it's given me a good snapshot of what you're doing, and it sounds really encouraging. And just to say thank you really for what you're doing in such difficult. And I think I can do as to help in any way, you know, please do let me know. It's a passion of mine, supporting people living with dementia, and in particular to try and improve their hospital experience as well, because I've got personal experience of what that can be like for not just those living with dementia, but families as well. And I know how important it is. But thank you very much anyway for giving me this opportunity at the start today.
Thank you very much. And if we bring it to a close now, thank you so much, Rhiannon, as well, and everybody on the call. And we'll see you on the other side, hopefully, on the next call. It does seem a bit strange, but we'll all jump off this one and then jump on the other one. So I'd just like to thank you all, and we'll see you soon in literally 3 minutes, hopefully. Take care. Thank you, everybody.
Bye.
Thank you. Bye.
Bye. Bye.